Ma'am, we are live now. So, with all
Yeah.
your permission, we are beginning with the session for today.
Okay, fine.
Yeah. A very good evening, everyone. This is Batul, the moderator for today's session from IGCP, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, she needs no introduction, but yet it's our great pleasure and honor to introduce her, and she's none other than the very renowned Dr. Smita Shah, ma'am. Ma'am is post-graduation in clinical nutrition, LL certified in metabolic syndrome by European Society of Clinical Nutrition and Metabolism, dietitian and obesity consultant at Diet Care Diabetes and Hormone Clinic, Ahmedabad. With ma'am's wonderful insight, we are going to talk about the topic for today as we are witnessing the National Nutrition Week. The topic for today is reversal of diabetes. And to talk about this topic, I would like to invite ma'am at our forum and would like to hand over the forum to her for her precious talk to begin. Ma'am, over to you. Please proceed.
Hello. Thank you very much for my good introductions. First, I would like to thank MadTalk and IGCP Group for inviting me to give me a talk for reversal of diabetes. So, today we will discuss the reversal of diabetes. Nowadays, the concept of the reversal of diabetes become very popular before 6 to 7 years back. What the reason behind that? Because now you can see the patients of the diabetes is increasing in the India and always also in the world. So you can see the prevalence of the type 2 diabetes. This is the atlas of 2021, and you can see the global, say the global prevalence, just over half a billion people with diabetes living with the diabetes. So is it increasing by day. Now, this is the prevalence of the diabetes in India. This is IDF from IDF Atlas. You can see that in their prediction for 2030 that 101 million people will be diabetic in India, but now it is into as per 2023 there we have 101 million people of diabetes, and you can see the forecast is to in 2050 45 it will be 134.2 million people. So the prevalence trend is very high in the India also. Now, what is the reason behind it for increasing the diabetes? Because our country in India, we are having more carbohydrate diets. So, what's the effect of the carbohydrates? We can see then we are eating the carbohydrates, the sugar rise very fast. And if you see this graph, after having protein, the sugar rise moderately, and after fat, it rise very slowly. So eat the carb, so definitely blood glucose goes up, and what happens? You become the insulin resistance, and it inhibits leptin and inhibits fat oxidation and fat storage, and then hunger is increased after having the refined carbohydrates. So this is the effect of the carbohydrate. Now you can see the life of the dietary carbohydrate, that carbohydrate converted to glucose and insulin support in absorbed by the cell as glycogen, and glucose stored in the liver to be used later after, and excess, even you are having excess protein, it also stored in the liver as a glycogen. What happens when liver full of the fat? What happens? The liver transfers the glucose triglycerides by process lipogenesis. And what's happened? The triglyceride level will be rise. So, if you are having more carbohydrate and excess protein, it will be increased in the triglyceride levels and increase in the VLDL level, also increase in the LDL level, and after it may be develop the cardiac disease. So this is the, you can see the life of the carbohydrates, dietary carbohydrates, and I am talking about not this complex carbohydrate, but we are having more simple carbohydrates and refined carbohydrates. So this is the twin cycle of hypothesis of the type 2 diabetes. This twin cycle hypothesis is a theory that explains how type 2 diabetes develop and can be reversal. It can be reversal. If twin cycle hypothesis propose that type 2 diabetes occurs due to the accumulation of fat in the liver, which induce the insulin resistance and hyperinsulinemia and excess fat around the liver and the pancreas and uh, excess fat store around the liver and the pancreas and the results excess fat for to the deteriorations and the decrease in of the beta cells, and after when fat around the pancreas, you can see the beta cells function decrease, and the results you can see the postprandial glucose level is going higher side. And due to the high fat in the liver, the insulin resistant because it's contribute for the insulin resistance. So in the prime driver, what is the behind reason behind this? The excess calorie intake. So if you are having excess calorie intake for the long time, definitely the excess calorie will go in the liver fat as well as in the pancreas, and then maybe develop diabetes. Now, how to reverse the diabetes? So you have to take U-turn. How to take the reverse diabetes? You have to remove the excess calorie. So this is the twin cycle hypothesis, isocalorie balance, that effect of the very low calorie diet on the twin cycle. So how it's possible? So because if you are having the isocalorie balance after the substantial weight loss, so what's happened? The normal liver fat will be in the liver, also reduce the VLDL, also reduce the subcutaneous storage capacity and decrease the islet triglyceride, normal insulin response, and is maybe the normal postprandial glucose. So have to do the low calorie diet. You go for the low calorie diet, it will definitely help to reverse your diabetes. Now, the twin cycle pathogenes, hypogenes of the etiology of the type 2 diabetes, you can see is hepatic insulin resistance and beta cell dysfunction reversible by decreasing intra-organ fat content. Yes, it can be. We can see in the counterpoint study. And is the return to the normal metabolism durable after the return of the isogenic eating? Yes, it is. We have also the counterbalance study and can be the translated into the routine management but of type 2 diabetes in the primary care. It is happens in the primary care, of course. Yes, we have also reported in the direct study they done in the primary center of the Scotland. So is there evidence for pancreas for being fat being these causes for the beta cell dysfunction? Yes, we have also this study for that. So this is the twin cycle hypothesis and etiology of the diabetes. Now, is this type 2 diabetes is reversible? That is the question. So this is what we are knowing since long time, that type 2 diabetes is irreversible and progressive with the beta cells damage. But restoration of the normal glucose metabolism with days after the bariatric surgery. Earlier, it was the option was only the bariatric surgery. In the majority people with type 2 diabetes, disprove this concept. So the reversal refer to the change in the direction of the underlying process, and to say that the type 2 diabetes is reversed, it's a statement that at point this time, this is for the that time. For the future, we cannot say anything, because if you start for the high calories and don't do exercise, definitely it relapse. So how can you put diabetes in the remission? How to go in the remission state? So the strongest evidence we have suggests that diabetes is mainly put in the remission by weight loss. The first step is you have to do weight loss. If you have obesity, you are more likely to put your diabetes into the remission. if you lose substantial amount of weight, at least 15 kg, as quickly as safely as possible following to your diagnosis. So if you diagnose the diabetes and immediately you do for the weight reduction, definitely you can go in the remission stage. If you don't want to start losing weight quickly to work towards the remission, it's important to talk to the dietitians or the physician. You cannot start with your own. And rapid weight loss is not advised if you are a healthy weight under 18 years, you are pregnant, you are breastfeeding, or have even been diagnosed with an eating disorder. So this is the guideline for the remission of the diabetes. This is the various guideline, but the conclusion is that this is the ADA guideline, direct guideline, Vita Health guideline, and Association of British Clinical Diabetes. All the conclusion is that remission, when we can say that the HbA1c should be less than 6.5%, or fasting glucose should be less than 126 milli per deciliter, and duration should be more than 3 months for the ADA guideline. And in the same direct guideline, the no diabetes medication for greater more than 2-3 months in previous 12 months, and HbA1c should be less than 6.5%, and duration should be greater than 1 year. So same, these all are main, the concept is your should HbA1c should be less than 6.5 with no medications. Now the advantages of the stages of the reversal for the patients. Provide a target and the reward for the sustained hard work usually necessary to achieve the target of the remission. So for the patient, you should give him as a target for the weight loss. Otherwise, he will not do anything. So you should give to the target to the patient that you have to lose at least 2 kg, 3 kg per month, and you have to do exercise, you have to follow the diet plan, and this all type of instruction you must give to the patients. Now, this is the natural history of the diabetes. You can see although the reversal is used synonymously for remission, both are the interchangeable word, remission and the reversal. So what this is the natural history. When the patient is healthy, it's okay. When it comes in the pre-diabetic stage, is impair the fasting glucose and impair the glucose tolerance. When he developed the diabetes with treatment where OHA and sugar is uncontrolled, start with the insulin and start the complication. This is the natural history of the diabetes. But when we want to reverse the diabetes, we have to go from left to right. So we have to go back. To diabetes reversal by pharmacotherapy and the lifestyle modification is the control. Reversal is stage 1, reversal stage 2, reversal stage 3, and prolonged remission at the cure. So there are evidence. How can we believe that is possible? So we have lots of evidence, lots of studies, and they conclude in the favor of the remission in the diabetes. So we will discuss regarding various studies. So this was study, but very low calorie diet and the 6 month of the weight stability in type 2 diabetes. In this study, this is the direct study, is the very popular study, and it was done in the primary care led with management for remission for type 2 diabetes, and it was done in this Scotland. The direct study clinical trial was randomized trial at 49 primary care practices in the Scotland and in the region of England, and weight management program was the intervention arm. So the best practice care by guidelines was the control arm, and individuals aged 20 to 65 years who had been diagnosed type 2 diabetes less than 6 years, and there had been and they were the insulin. So this study was start in 2014. So this study was start, and you can see the results. So the weight loss of 15 kg or more in 36 participants in the intervention group and no participants in the control group. There were two groups, intervention and the control group. So the good result was in the interventional group, and diabetes remission in 68 participants in the intervention group and 6 participants in the control group. So you can see the results of the interventional group. So intervention participants and 3 2% of the control participants have weight loss at least the 15 kg. So the interpretation of this study is that the diet program sustained remission at 24 months. For more than one third of the people with type 2 diabetes, sustained remission was linked to the excess sustained weight loss. So this was the very good study, and the remission was possible. So the conclusion of the direct study is that the 12 months, almost a half, 46% of the participants achieved remission on the non-diabetic state and off antibiotic drug. They were on the anti-diabetic drugs. So remission of the type 2 diabetes is the practical target for who the type 2 diabetes less than 6 years duration. It's not possible for the long time of duration like 10 years, 20 years. And subjects the BMI should be greater than 25. If the BMI is greater than 25, it's possible, very good. And not on the insulin at the enrollment, and willing to motivated to follow the low calorie diet for 12 months, 12 weeks. So what in India is possible? The evidence of effectiveness beyond 2 years is very limited. It is not for the long time, and the culturally diverse Indian society hampers sustainability of liquid art. It was totally liquid and the diet formula. So in India, that is maybe is not possible and leading to relapse the quicker than remission. And routine Western meal choices such as soup, bars, and sage does not satisfy the Indian carbohydrate driving plate, because we are Indians and we are having more carbohydrate. So in our country is very much difficult for the formula diet and also liquid diet. So second study is the counterpoint study. In this study, the reversal of the type 2 diabetes, and that was the study. And this study was 11 people with the type 2 diabetes was enrolled. And in this study also they offer very low energy liquid diet. The composition of the diet was 46% carbohydrate, 32.5% protein, and 20.1% was fat. So this was the study, and you can see the results of the counterpoint study. So in this study, you can see the liver fat. Liver fat was reduced after 8 weeks. You can see, and insulin sensitivity was increased after 8 weeks. And in the pancreas, you can see the fat percentage was reduced after 8 weeks due to the very low calorie diet, and insulin secretion you can see was increased after 8 weeks. So this study was very low calorie diet, and it was, but after 8 weeks the results were excellent. And this study was, but it was only the 14 patients and very low calorie diet, and it was the 3 sachets of the liquid meal replacement, and total calorie was only 600 to 800 kilocalories. Also non-starchy vegetables and salad. And end of the first week, the plasma glucose reduced from 9.2 millimole to normal, and 30% reduction in the liver fat. And by end of the week, 8 weeks, 15.3 kg weight reduction was done. And at the follow-up, remission of the diabetes in 11 patients at 12 weeks. So out of 14 patients, 11 patients goes to the remission point. So this is the MRI of this. They done the MRI of that, and they get the results for that. Now, the literatures search found the total 99 original article containing the information parenting to the diabetes reversal and the remission and bariatric surgery has been the recommended for the treatment of type 2 diabetes since 2016 by American International Diabetes Conscious Group. So evidence exists that type 2 diabetes reversal is achievable using the bariatric surgery. Otherwise, you have second option, very low calorie diet and very low carb diet. So this reversal of type diabetes is a narrative review for evidence that diabetes reversal is a possible alternative to consider in place of traditional diabetes management. In that, the most effective is the bariatric surgery. Low calorie diet and low carbohydrate diet are good option for that, but it is for the short time. So this is the Indian data. This was done by uh, Dr. Uni Krishnan and Dr. Anjali Bhatt. This study was done 3 months earlier than the direct study, and in this study, uh, the intervention group they were given 100 kilocalories, 15% carbohydrate, 30% protein, and fat 20%. And you can see the result was the HbA1c was 9, and after the 12 weeks the HbA1c was 6.2, the reduce up to 3, almost the 3%. Now this is the intervention. This study was done in our clinic at Ahmedabad, and this intervention of a personalized low carbohydrate diet to reduce the HbA1c level and weight in the patients with the type 2 diabetes using seed based flour as replacement for high carbohydrate flour and food. So generally in the Gujarat, we are having very thin roti and we are using very thin flour like a maida flour. So at that time, the sugar going up after postprandial sugar is going up and up because they are having 4 and 5 rotis. And we in this intervention, we add some seed based flour and some fibers in the flour and to the patients, and you can see after 12 weeks that first at the time of the enrollment the HbA1c was approximately 8.6%, and after 12 weeks it's come down up to 6.31%. So this is only we uh, add seeds as well as the fiber in the flour, and we cut off some carbohydrates, refined carbohydrates, add fibers and some proteins. So this is the two type 2 diabetes two hallmark is first is the insulin resistance and second is the beta cells defects. So the management of the hyperglycemia in type 2 diabetes in 2018, a conscious report by the American Diabetic Association and the European Association for Study this of the diabetes, that the recommendation are all overweight and obese patients with diabetes should be advised for the health benefit of the weight loss. The main our goal is focus in the weight loss and encourage to engage in the program of intensive lifestyle management like exercise, which may include the food substitutions. And non-surgical energy restriction for weight loss is if the patient wishes aim for the remission of the type 2 diabetes, particularly within 6 years of the diagnosis. Evidence-based weight management program are often successful. So this is the direct study. It was a very low calorie study, and it was its results. You can see the 15 kilo weight loss, and the remission was up to 2 years. Now, possibility of reversal of the diabetes in the high carbohydrate diet region in the world map. You can see this India. In the India, we have 70 to 75% of carbohydrate using. So our people in Indian people are using more than 65% of the carb. So this formula and this plan is not supporting for our patient for the long time. Now the reversal is a fact or fiction. There are so many questions and so many debate on that reversal is possible, remission is possible, we can discuss about the and fact and fictions. The fact, because we have so many randomized control trial to prove that one third of the patient achieve the remission in 2 years. There are a number of trials and they come to the conclusion that remission is possible. But how many diabetes remission cases have we actually seen in our practice? And the fiction is that in the real world, only the less than 0.1% patients are benefited after intensive educations. So the fiction, type 2 diabetes reversal is very easy. Nowadays, you can see so many advertisement on the social media. There are so many commercial organizations. They claim that you joined to enroll in our program, and within 3 weeks and 4 weeks, you can reverse your diabetes. So the diabetes is reversal is easy. So the people mean that is very easy. Diabetes reversal is not the great task. So that is the type 2 diabetes reversal is easy and can be achieved 6 to 8 weeks by joining the program. If we join the program, we can reverse the diabetes. Cut off the car, fruits and sugars and you will reverse the diabetes. There are lots of myths for that. Type 1 diabetes can be reversed. No, it not can be. It can't reverse. Many scientists are not ready to accept this diet due to uncertainty. And regarding the benefit, short-term weight loss is slightly and higher the conventional weight loss diet, but long-term results are not known. We have not the long-term data. So this is the 180-degree changes in the low carbohydrate. Right now, we are using this general. We are using 55 to 60% carbohydrate, protein 12 to 20%, and fat 15 to 30%. So the change needed. How it's possible? Because the carbohydrate is only 5 to 25%, protein 12 to 15%, and lots of fat 860 to 80%. But RDA guidelines, we can see that not less than 130 grams. Even ADA recommendations that diabetic patients should have at least 130 grams of the carbohydrates. So the eating pattern and the macronutrient distribution. How to diet help for remission of the diabetes? So simple thing. The emphasis should be on healthful eating, not on the macronutrient distributions. It should be individualized. And emphasis should be on healthful eating pattern containing nutrient-dense food, which let focus on the nutrient macro distribution of the nutrient. You can see the portion control, that is the most important. Healthy choices like legumes, fruits, vegetables, nuts, and fibers, and uh, regular exercise. You can lose the weight and you can control your diabetes as well as you go for the remission. Now, the goal of the nutrition therapy for adults with the diabetes. So, to promote and support the healthful eating patterns. The eating pattern is the most important with the focus on the portion control. That is the most important. The focus on the portion control. You must uh, uh, teach the patients that portion, how much portion you have to take in the breakfast and in the lunch, and achieve the goal for the body weight and blood glucose, blood pressure, and the lipids also. We focus on the blood pressure control as well as the lipid controls, and to address individual nutrition needs. Its individual nutrition needs is vary from patient to patient, so we must consider this as a personalized individual plan. And on the personal cultural preference, that is most important. How he likes and dislikes and the cultural profession. Because in the south their staple food is rice and we cannot restrict only rice. So we must consider that. And to provide the practical tools for the nutrition. You must explain about the food exchange. Sorry, yeah, you must give them the food exchange as well as the carbohydrate content. You can give them the some knowledge of the carbohydrate, as well as there are so many applications are available on the net that patient can use it. You can give them the and full measurement, also katori and glasses. So you can, practical knowledge is most important for the patients, and focusing on the individual nutrition therapy. So the lifestyle and the nutritional intervention are among the key players for achieving the diabetes-free quality of life. Moreover, protein, fibers, and the low glycemic index are key pillars when trying to achieve the diabetes reversal through nutrition. And it is the well-established fact that the modest sustained weight loss, even 5 to 10%, can reduce the risk of type 2 diabetes by decreasing the insulin resistance, improving the glucose tolerance, and the glycemic control. We have so many data that even 5% or 10% weight reduction will help to reduce the diabetes complication, as well as the reduce the help to decrease the HbA1c. So management of the very low calorie diet, BLCD, and the low carbohydrate diet, uh, this is not more than 112 kilocalories. And when does MNT become effective? So willingness to change. If the patient wants to uh, motivated and he are ready for the changes, that is the most important, and receive the individualized medical nutrition therapy and sensitive to the personal needs. We must consider the personal needs. If the patients have lactose tolerance, yeah, here the glucose tolerance, you have the lactose tolerance, yeah, here the gas problem, yeah, here the some allergy on the food. So we must consider, and we must consider, and we have to set up the diet for as per his sensitivity. So that is most important. And now the conclusion: the more fat in the body can lead to the excess fat in the liver and the pancreatic fat, and subsequent loss of the plasma glucose control. So the not more much more calories and the fat. The traditional concept of the type 2 diabetes being irreversible and progressive disease has been changed. Now, earlier it was said that diabetes is not curable, but nowadays it can be reversed and it can be go in the remission phase. So the evidence exists that type 2 diabetes reversal is achieving using the bariatric surgery, and the patient who are not go for the bariatric surgery, the low calorie and the very low calorie diet and the low carbohydrate diet will help him. In most cases, remission occurs due to profound weight loss. If people regain weight, is that usually do the diabetes eventually come back. As a dietitians, we must grasp the paradigm shift in our understanding of the type 2 diabetes and medical nutrition therapy for the benefit of the patients. And we can see our using stage, then complete remissions. The take home message is diabetes is reversible in those with type 2 diabetes, in those with the short duration of the diabetes. That is most important. If the patient is have duration of 2 3 years, yeah, 4 years up to, it's very useful. And by severe weight loss and calorie restriction. So suppose this patient is very obese, is a morbid obese, you go for the more weight loss, he will maybe go in the reversal position. Now the diabetes is when the diabetes is not reversible in the type 1 patient. For type 1 patient is not possible, and in those with the type 2 diabetes who have already developed the complications, he have some diabetes related complications or late stages of the disorder. The blood sugar is more than 20 years or 30 years, he developed the complication. So that is not, for that, not possible for the reversal. So in a real world scenario, the patient committed and following low calorie diet are very low in practical way. And people who are able to stop diabetes medications are very, very low. There is always a chance of relapse if you stop the medications. And remission should not be the target of the diabetes management. So first you focus the control of the diabetes, then you think about the remission. And defining the clinical stages of the patient diabetes reversal journey very much clinically acceptable, and also very motivating to the patient to define the achieve the next level target. So thank you very much.
Thank you so much, ma'am. Thank you for your overwhelming talk that you have shared on our platform and for making our viewers understand about the topic in such a better manner, and
Yes.
for making us aware of the such important information that you have shared on our platform. We have received few questions from the participants. So with all your due permission, I would like to put across those questions to you. So the first question is related to the bariatric surgery. So what
Yes.
role does bariatric surgery play in the reversal of type 2 diabetes, and what are the long-term outcomes?
Yeah, of course. Earlier, the bariatric surgery was the good for the reversal of the diabetes because what's happened in the bariatric surgery, sleeve gastrectomy and gastric bypass, the stomach size is very reduced, and at that time, the patients eating eating habit pattern already having very low amount of the food, and second thing, the satiety increase. Okay, so that is the good point for the patients. To he can lose the weight, and definitely he will lose the fat from the liver as well as from the around the pancreas. So it will become he will become more insulin secretion, and the intake will be very down. So definitely it will have to uh, remission in stage in the diabetes is almost in the bariatric surgery after almost the patient not on the remission part, but they can go in the cure in the some for long term. Other after some times, if they regain the weight and they started more foods, so they will maybe they will relapse the diabetes. Then it's maybe relapse the diabetes. But main the benefit of the bariatric surgery is food is become very low, and satiety is going high.
Thank you so much, ma'am. Thank you for answering that question. Moving ahead with the other question that we have received, and the question is related to effective lifestyle interventions. So, how effective are lifestyle interventions, diet, exercise, weight loss, in reversing early stage diabetes or pre-diabetes?
Yeah, of course, the patient is the pre-diabetic. We know that this, in pre-diabetic stage, the main problem is the hyperinsulinemia. Their insulin level is very high, and he feels every and he suppose he have carbohydrates, more carbohydrates, his sugar will go up, and then after immediately it will go down, and he feel hunger pangs. Okay, so at that time, the lifestyle modification is most important because we recommended them very uh, uh, we restrict the refined carbohydrates, and we shift it in the complex carbohydrate, more fiber, more protein, and the amount of the carbohydrate we restrict. And at that time, we increase the protein, so his satiety will be increased as well as his weight will be loose, and definitely he go reverse in the normal range for the pre-diabetic. And who are the diabetic in newly detected diabetes, or he has diabetes less than 4 years? So definitely first we emphasize on his diet plan, low calorie as well as low carbohydrate diet. Add the fibers, nuts, legumes, and sprouts, and pulses, and the millets we can introduce. And exercise, we focus also on the exercise, the do regular exercise, and he is able to lose the weight. So definitely go in the remission stage, he may be off medicines, and then he can go completely cured.
Thank you so much, ma'am. Thank you for answering that question. Moving ahead with the last question before we conclude, and the question is
Yes.
related to biomarkers. So, what are the biomarkers or clinical indicators used to assess the success of diabetes reversal?
Yeah, good marker, biomarker is the first is it should be when we can accept that this is the diabetes reversal. The first is HbA1c. His HbA1c should be less than 6.5. He without medications. That is the most important. If his HbA1c less than 6.5 up to 1 year, and no medicine except in direct study they are allowed metformin. but as per ADA guideline, uh, uh, it should be not medicine and off medicine, as well as its HbA1c should be less than 6.5. It's a, we can say that it's a remission of the diabetes. There are interchangeable, the remission and reversal is the interchangeable words. You can see. So some people say that reversal means cure, but this is not means cure. But reversal means you are going, your diabetes journey is going to reverse. So suppose you are on the insulin therapy, you go for the lifestyle modification and low calorie diet. So you can off insulin and you can on the OHA. And suppose you are on OHA and you go for the lifestyle modification low calorie diet, so you may be off the medicine and your HbA1c should be controlled. So this is mean this is the reversal of the diabetes.
Thank you so much, ma'am. Thank you for answering that question and all the other questions for our viewers and for making them understand about the topic in such an elegant manner. Thank you so much for putting up your presentation and for doing this efforts and for making us aware of this particular thing on this nutritional National Nutrition Week that we are observing. Thank you so much for that. And with this, I would like to thank all our viewers for their ardent participation that they have shown by staying tuned with us throughout the session. And I would also like to thank all of them for spending their time out and for being connected with us. So, thank you to all of them.
Thank
Before we
you very
conclude,
much.
ma'am, any last take home message from your end?
Yeah, last take home message is the diabetes is increasing in the India is very fast, and earlier it was up to in the adult population, but nowadays even the children's adolescent are diagnosed with the diabetes type 2. So we must focus on the diet. That is the most important. That junk food, and we must educate the patient, educate the society for the food, as well as emphasis on the exercise. So it we can in future we can prevent the diabetes. Otherwise, the diabetes is increasing very fast. So my message is that healthy diet and exercise for not only for the diabetic patient but entire the family of the diabetic patient, as well as for the children, adolescents, and for the young people.
Thank you so much, ma'am. Thank you for such valuable take home message from your end. I hope this is going to benefit our viewers for their clinical practices. Thank you so much for it. And with this, we would like to conclude the session here for today. Until next time, so stay tuned, everyone, for further episodes at our platform. Thank you so much.
Thank you very much.